We're like 30 plus years into the epidemic, and we've undergone a sea change when it comes to therapeutics. I think that the ability to accurately measure the virus and detect it has been the tool that has gone forward to help us define agents that act quickly in humans. And I think that the ability then to do combinations of drugs to deal with the resistance issue and the sequence variability issue in the viruses let us build this amazing set of agents. And as a new class of agents gets developed, they improve pharmacologically and in terms of side effects, the point where we have multiple combinations that are one pill once a day. And it's pretty amazing. It's both good and bad. I think it's important that we don't have the urgency was a great thing at the beginning to really keep us organized and galvanized. Now we really have to continue to keep the fight up, because as good as it can be here, it's also unequal. You've got people with insurance that can do very well, and if you don't have health insurance, you actually can't have the same kind of care. Globally, there are about 36 million people who are infected with HIV. Only about a third of them have access to therapy. So if you think about where therapy needs to get to, it needs to continue to go global. PEPFAR and the Global Fund need to continue to do their job. I think that and this was a Colin Powell approach, that health is a major driver of stability in a country and economic stability. And if you want to continue to destabilize large portions of Africa, what better way than to have HIV continue to go rampant? Perfect example of what we're seeing in West Africa now with Ebola. It's a major destabilizer. Who's stepping in? The US government, WHO, and others. But at the end of the day, health, the globe needs to appreciate, the people of the globe need to appreciate that health is a right. It should be a right. And in some ways, they need to demand that from their governments at the same time. Back in the late 80s, as we were beginning to develop therapies, I cut an article out of a journal that John Bartlett at Hopkins had written, and he said, the immediate goal is to create a situation where HIV is a chronic, manageable condition. And I kept that over my desk for a very long time until it was. And then the research goals have evolved. It's now, can we get a safe, effective, and durable HIV vaccine? Because that is the ultimate way to end the epidemic, is through vaccination. So I think the research agenda is very focused now on vaccines and cure, as well as understanding the consequences of long-term treated HIV disease. What we have is, as people continue to be healthy with HIV, they're an aging population like everybody else. Except it's interesting, they tend to get the comorbidities of aging faster, and that's also an interesting set of challenges for both researchers and clinicians. I think that's the ultimate goal, is to get a vaccine that would be, I would actually want it to be more like the smallpox vaccine, that it was immunity for life. I think that where we are on the vaccine front, there are a number of really interesting leads, and we had the RV144 trial, the Thai trial, that had about a 31% efficacy. Now that we understand how that vaccine worked, we have made some new designs for vaccines like that and are about ready to start testing in Africa. And so the goal would be 50 to 60% effective. Even a vaccine at that level, if it could be made durable, would have a profound influence on the African epidemic.